They suspended her at 7 a.m. on a Tuesday. By 9:14 a.m., 86 people were bleeding on the floor of the same hospital that threw her out, and not one of the doctors still standing knew what to do. Dr. Victor Hale had spent 3 weeks trying to remove her. He finally succeeded. Then the plan exploded. Then the ambulances came. Then the nurses looked around for someone who had actually seen mass casualties before, and the only person in Bozeman who had was sitting in the parking lot with a cardboard box and a suspended badge. Her name was Emily Rourke, and they were about to need her more than they had ever needed anyone. Before we go any further, if you're new here, hit that subscribe button right now, because the story you're about to watch is exactly the kind we tell on this channel. Real tension, real consequences, and people who get underestimated until the moment everything falls apart. Like this video, drop a comment telling me what city and country you're watching from. I want to see how far this story travels. Now let's get into it. The suspension letter used the word insubordination 4 times. Emily counted. She was sitting in the HR director's office on the 3rd floor of Cascade Ridge Medical Center, holding 2 pages of formal language that boiled down to one thing. Dr. Victor Hale wanted her gone, and he had finally found enough paperwork to make it happen. The HR director, a man named Gerald Forsyth, had the practiced look of someone who delivered bad news often enough that it no longer bothered him. He sat with his hands folded on the desk and explained that her behavior during the Denton procedure on March 11th had been reviewed by the disciplinary committee, that multiple attending physicians had submitted written statements, and that the committee had voted to suspend her badge pending a full review. Pending a full review, Emily repeated. That's correct. Which means you haven't decided yet whether to fire me. Forsyth shifted in his chair. It means the process is ongoing. Emily looked at the letter again. The Denton procedure. That was what they were calling it. A 62-year-old man named Raymond Denton had come in through the ER on March 11th with abdominal trauma following a car accident. Hale had ordered a specific surgical approach that Emily had flagged as contraindicated given Denton's blood pressure readings and the visible bruising pattern across his lower abdomen. She had said so clearly, in the room, in front of 3 nurses and a first-year resident. Hale had told her to step back. She had not stepped back. She had kept talking until Denton's primary care physician, who happened to still be in the building, walked in and agreed with her assessment. Hale had changed the approach. Denton had survived. And 6 days later, Emily was sitting in an HR office being told she was suspended for insubordination. She set the letter down on the desk. I need your badge and your access card, Forsyth said. She unclipped the badge from her scrub pocket. She slid her access card out of its lanyard sleeve. She set both items on the desk between them, and she stood up without saying anything else, because there was nothing left to say that would change what was already decided. The walk to the elevator was longer than it had ever felt. Cascade Ridge Medical Center occupied 4 floors of a building on the west end of Millerton, Montana, a city of about 90,000 people that had grown fast in the last decade as manufacturing expanded east from the mountains. The hospital had grown with it. New wings, new equipment, new administrators who cared more about liability exposure than clinical outcomes. Emily had recognized the culture within her first 2 weeks of working there and had told herself to keep her head down. She had never been good at keeping her head down. She had started as a travel nurse 6 weeks ago, placed through an agency after nearly 2 years of working contract positions across different states. Before that, before the contracts and the moving and the careful, deliberate effort to stay anonymous, she had been someone else entirely. She did not think about that part of her life often. It had a way of complicating things. The elevator opened at the lobby. She crossed the main entrance and pushed through the glass doors into the cold Montana morning. Her car was a 2017 Honda Accord with a cracked passenger side mirror that she kept meaning to fix. She sat in the driver's seat without starting the engine and looked at the hospital entrance for a moment. 2 nurses she recognized were coming in for the day shift, laughing about something, not looking at her. The automatic doors opened and they disappeared inside. She started the engine. She was 11 minutes from her rented apartment when her phone rang. It was Marcus Webb, the charge nurse from the night shift, someone she had worked alongside for most of her 6 weeks at Cascade Ridge, and the closest thing she had to an ally in the building. I was not the type to call someone at 8:30 in the morning unless something was wrong. She answered. They really did it, he said. Yes. I heard it was Forsyth who handed you the letter. It was. A pause. Traffic moved around her on the highway, heading toward the apartment complex on Route 9. Mountains sat at the edge of the skyline in both directions, white at the peaks and deep green below the snow line, indifferent to everything happening in the city beneath them. You should contest it, Marcus said. Maybe. Emily, you were right about Denton. Everybody knows you were right. Everybody knowing and anybody saying it out loud are two different things. He didn't have a response to that. I have to go, she said. I need to figure out what comes next. She hung up and drove the rest of the way in silence. The apartment was on the second floor of a building that smelled faintly of old carpet and someone's cooking on the floor below. Emily had furnished it minimally. A mattress frame, a small table, 2 chairs, a bookshelf with maybe 15 books, and some medical reference texts she had hauled through 5 states. She dropped her bag on the table and stood in the kitchen and thought about what she needed to do. She needed to contact the agency. She needed to review her contract language to understand whether a suspension triggered any termination clauses. She needed to eat something because she had been in the HR meeting at 7 a.m. and had not had breakfast. And she needed to decide whether she was going to fight this or simply move on to the next assignment. She put water on the stove for coffee and sat down at the table with her phone. The agency call was brief. Her placement coordinator, a woman named Sandra, who had always been professionally warm without being particularly invested, listened to Emily's summary and said she would look into whether the suspension created any contractual complications and call back within a few hours. Emily said thank you and ended the call. She was still sitting at the table when the first alert came through at 9:02 a.m. It came on the emergency broadcast system, the tone she hadn't heard outside of drills in a long time. 3 sharp pulses followed by an automated message. She turned up the volume on her phone. The message was directing all available emergency personnel to standby status. An incident at the Ironfield processing plant on the industrial corridor east of the city. She opened a news app. There was already a brief text bulletin. Explosion reported at Ironfield, fire crews responding, casualties unknown. She set her phone down. She poured the coffee. She sat with it for approximately 4 minutes before she picked her keys back up off the table. She did not go to the hospital right away. She drove toward the industrial corridor first because she wanted to understand the scale of what she was potentially looking at, and because she had learned a long time ago that walking into a disaster without situational awareness was how you became part of the disaster instead of the solution. She could see the smoke from Route 12. It was a wide, dark column rising from somewhere behind the tree line east of the highway. The kind of smoke that told you something structural was burning, not just a contained fire. She watched it for a moment from the car and estimated based on the column width and the direction it was drifting. The wind was coming from the northwest at maybe 10 or 12 miles per hour. Her phone was showing updates in fragments. The Ironfield plant processed metal components for agricultural equipment and had roughly 300 employees across 2 shifts. The morning shift would have been in the building. She turned around and drove toward Cascade Ridge. She was not going to pretend she had thought this through. She knew that going back to a hospital that had suspended her badge 4 hours ago was not a decision that would make sense to most people. She also knew what a mass casualty incident looked like when it arrived at a facility that was not prepared for it, and she knew what happened in those first 30 minutes when nobody in the room had done it before. She had done it before. Many times. In conditions that made this look manageable by comparison. She parked in the visitor lot and walked toward the ambulance bay. The first vehicles were already arriving. 2 ambulances were backed up to the bay doors, and another was pulling in behind them. Emily could hear the radio traffic from a portable unit. Someone had left on a supply cart near the entrance. The numbers were already past 24 patients en route, with more on the way. She pushed through the bay doors. The ER floor was not yet in chaos, but it was close. She could see the moment when organized urgency was about to tip into something harder to control. Nurses moving fast but without clear assignments. A resident standing near the main station, looking at a tablet with an expression that suggested he was trying to calculate something he did not have enough information to calculate. Dr. Hale was somewhere in the back. She could hear his voice, but he was not visible from where she was standing. Marcus Webb saw her from across the floor. He crossed to her in 6 steps, speaking before he arrived. "You cannot be here without a badge." "I know. Security will pull you out." "I know that too." He stared at her. "How bad is it out there?" The smoke column suggests structural collapse. Could be secondary explosions depending on what they store on site. You're going to see blast injuries, crush injuries, inhalation damage, and probably burns. You need a proper triage set up outside before they bring everybody through the same door. He was already looking back at the floor. We don't have anyone who... You have me. Emily. Marcus. How many are coming? He glanced at his tablet. Current estimate is 60 to 90. Could go higher. She had seen 90 in worse conditions. She had seen 90 in a forward operating base with 3 medics and a half-collapsed supply tent and no backup for 6 hours. Who's running trauma command? Hale assigned himself. She kept her face neutral. Okay, I can work around that, but someone needs to set up a triage station at the lot entrance before the next wave arrives. Sort them before they come through the door, or you're going to have critical patients buried behind walking wounded. Marcus made a decision. She watched him make it, the slight change in his shoulders, the exhale. Come with me, he said. The next 45 minutes were the kind that compressed time in both directions. Each individual moment felt slow and thick with detail, but when she looked back later, she would not be able to account for all of it in sequence. She worked the triage station outside with a second-year resident named Dr. Callum Briggs, who had the quiet, focused manner of someone who learned well under pressure. He did not question her. He watched what she did and followed the pattern. She explained her reasoning out loud because she knew he needed to understand the logic, not just the instruction, a habit from years of working with people who would have to make the same decisions without her next time. A man with a laceration across his scalp and left shoulder kept insisting he was fine and needed to get back to the plant because his coworker was still in there. Emily talked to him while she moved through his secondary assessment. His left arm had a range of motion problem he wasn't feeling yet because his adrenaline was still handling the pain. She tagged him for imaging and sent him inside without telling him what she suspected because the information would not help him right now and would likely keep him from cooperating. A woman arrived in the 3rd ambulance who was not breathing adequately. Partial airway obstruction from what appeared to be inhaled debris. Emily was on her in 40 seconds. She worked fast, communicated clearly to the paramedic who had brought the patient in, and had the airway clear before the woman was transferred inside. Callum Briggs said nothing, but she saw the way he watched her. She kept moving. Inside the ER, the situation had developed in the way she had expected, better organized than the first moments, but still stretched thin in the wrong places. She saw 3 nurses managing patient flow in a way that was going to create a bottleneck near the imaging corridor within the next 20 minutes. She communicated a rerouting suggestion to Marcus, who implemented it without argument. She did not see Hale for nearly 20 minutes. When she did, he was coming out of a trauma bay at the far end of the floor, removing his gloves, and the moment he saw her, his face changed in a way that was not difficult to read. He crossed the floor. "You were suspended this morning," he said. "Yes." "You need to leave this building." Around them, the ER was moving, nurses passing with equipment, a gurney rolling toward imaging, someone calling out a blood type request over the intercom. "There are 73 patients in this building right now," Emily said. "More on the way. You're short on qualified personnel, and you have at least 2 triage misclassifications in the waiting area that need to be addressed in the next 10 minutes. You don't have the authority to..." "Bay 4, she said. "Male patient, approximately 50, tagged yellow. His respiratory rate is wrong for a yellow tag, and his skin color is not matching what you'd expect for a stable inhalation case. He needs to be re-evaluated before something changes fast." Hale stared at her. "I'm not here to fight you," Emily said. "I'm here because people are going to die if this floor doesn't function correctly for the next 3 hours. After that, I'll leave. You can suspend me again if you want." Hale looked at the floor. He looked at the patients. He looked at the 3 nurses who were nearby and had definitely heard every word. He did not tell her to leave again. He turned and walked toward Bay 4. Emily went back to work. It was Marcus who came to find her at 11:40 a.m. while she was helping a burn patient from the 3rd wave of ambulances manage the pain response in a way that didn't compromise his blood pressure stability. Marcus came quietly and waited until she had a moment between steps. "There's someone at the main entrance," he said. "Who?" "Military. I don't know. He came in with 2 other people and he's asking for the hospital administrator, but the administrator isn't here today and they redirected him to Forsyth." Emily kept her hands moving. "That's not unusual. Ironfield has defense contracts. Could be a liaison." "Maybe," Marcus said. but he's asking for someone specific. She looked up. He has a name, Marcus said. He's been asking since he walked in. She waited. Rourke, Marcus said. He's asking for Emily Rourke. The burn patient made a sound. Emily refocused, finished what she was doing, secured the dressing, and passed the patient to another nurse with clear instructions. Then she stood up straight and turned toward the main entrance. A man in a uniform was standing 40 feet away across the ER floor. He was not young, mid-50s, maybe older, with the kind of posture that had nothing to do with effort and everything to do with decades of training. Two people flanked him, a woman in civilian clothes with a bag over her shoulder and a younger man in uniform carrying a folder. The older man in uniform was scanning the room. When his eyes found Emily, he stopped scanning. She knew his face. She had known it for years, in the way you know the faces of people who were present at the worst and best moments of your life simultaneously. People who saw you at full capacity, and people who were there when everything collapsed. Brigadier General Warren Stills. He had not changed as much as she expected. The same deliberate way he held himself, the same economy of expression. He was looking at her the way people looked at someone they were relieved to find in one piece. He crossed the floor. Emily did not move. When he stopped in front of her, he did not offer a handshake. He looked at her for a moment without speaking, taking in the ER behind her, the patients, the controlled chaos she had spent the last 2 hours building into something functional. "I heard you were in Millerton," he said. "I didn't know you were here." "I work here," she said. "Or I did this morning." Something moved across his face. "We need to talk." "I'm a little busy right now." "I know." He glanced at the floor around them, at the moving nurses, the patients, the resident Callum Briggs who was watching from a careful distance. "I can see what you've done here." "General, what you've been accused of," he said quietly, and his voice had a careful weight to it that she recognized from briefings in tents in places that no longer existed on any map she could access, is not what happened. And the people who made it happen are going to answer for it. Emily looked at him. "There's a federal investigation that has been running for 14 months, he said, "and your name has been in it since the beginning." The intercom above them called a code across the ER. Somewhere in the building, something was changing fast. Emily's body moved before the rest of her caught up, turning toward the sound, calculating, already mapping the fastest path to wherever she needed to be. "We need to talk," Stills said again, "but right now I need you to keep doing what you're doing." She was already moving. Behind her, the general watched the woman the army had spent 4 years trying to erase walk back into the center of the crisis like she had never left. The code was a respiratory arrest in Bay 7. Emily got there before the assigned resident did. The patient was a man in his mid-40s, a plant worker based on the remnants of his work clothes, the fabric cut away by paramedics during transport, with blast injuries across his left side, and what she could see immediately was a tension pneumothorax developing faster than his oxygen saturation could keep up with. The monitor was screaming. A nurse named Priya was already at the bedside doing compressions, but the compressions were not going to fix the underlying problem. "Stop," Emily said. Priya looked up. "He doesn't need compressions. He needs needle decompression. Right now." "I can't." "I know. Get me a 14 gauge and step back." There was a half-second where protocol and reality collided in the room, the kind of half-second that in a normally functioning hospital would have resolved in favor of waiting for a physician. But the physician assigned to Bay 7 was currently managing a hemorrhagic case 2 bays down, and the monitor was showing a pattern that did not have the patients for protocol. Priya handed her the needle. Emily found the landmark, second intercostal space, mid-clavicular line, and did what needed to be done. The sound of air releasing was immediate. The monitor changed within seconds. Not perfect, not stable yet, but changed in the direction that meant the man in front of her was still going to have a chance to make decisions about his own life. Dr. Callum Briggs arrived at the bay entrance 30 seconds later, slightly out of breath, taking in the scene. "Tension pneumo," Emily said without looking at him. "Decompressed. He needs a chest tube and imaging as soon as you can get him there. Left side blast injury. Yeah. Check for rib fractures in the 4 through 7 range." Briggs moved to the bedside and took over. He did not question her assessment. He did not ask who had authorized the procedure. He looked at the patient's color, looked at the monitor, and started giving orders to the nurses in the room. Emily stepped back and let him work. She moved into the corridor and leaned against the wall for exactly 4 seconds. Her hands were steady. They were always steady during. It was the after that sometimes caught her off guard. The way her body held everything at a distance while it was needed, and then released it all at once when the immediate crisis passed. She had learned to manage that release in small increments, 4 seconds of stillness, then forward. She went back to work. General Stills had moved to the far side of the ER floor near the administrative corridor. She could see him from across the room when she passed between bays, standing with the woman in civilian clothes and the young officer, speaking quietly, watching the floor. He was not interfering. He understood operational space, understood that the worst thing you could do in the middle of an active crisis was introduce a new variable. He had always understood that. It was one of the things she had respected about him, once, before everything that came after made respect a more complicated thing to assign. She did not go to him, not yet. There was still too much to do. The third wave of ambulances arrived at 12:15 p.m. and brought with it a problem that the first two waves had not. A man came off the third truck who was not from the plant. Emily clocked it immediately. His clothing was wrong, no work gear, no burns or blast residue on his skin, and he was conscious and oriented in a way that contrasted sharply with the genuine trauma cases around him. He was claiming chest pain and difficulty breathing, and the paramedic who had brought him in had accepted the claim at face value because the scene at Ironfield was still active and chaotic, and nobody had time to screen for people who were not actually injured. She assessed him in the triage lane. His vitals were within normal limits. His respiratory rate was slightly elevated, but in the range consistent with anxiety rather than injury. His skin was dry. His pupils were equal and reactive. When she pressed on his abdomen, he did not have the involuntary muscle response that genuine pain produced. "What's your name?" she asked. "Darren," he said. "Darren Schultz." "Where were you when the explosion happened, Darren?" I was near the east entrance, loading dock area." "Were you inside the building?" A slight hesitation. "Just outside." "Okay." She made a note. "What do you do at the plant?" Another hesitation, smaller this time, but visible if you were paying attention. "Maintenance." She looked at him for a moment. She had met people in trauma situations who were not injured but were in genuine shock. Workers who had watched colleagues die. Bystanders who had been close enough to feel the concussion of the blast. Those people had a particular presentation, a kind of hollow, unfocused quality to their eyes, an intermittent dissociation from what was happening around them. Darren Schultz did not have that. He was watching the ER floor with a focus that was too specific, too directed, like someone cataloging rather than surviving. "I'm going to have someone bring you inside and get you checked out," she told him. She flagged a security aide and asked him to take Schultz to a secondary waiting area. Then she stepped aside and pulled out the temporary communication badge Marcus had given her. Not a staff badge, just a channel tag so she could reach the charge desk, and called Marcus directly. "I need someone to do a quiet background check on a name," she said, keeping her voice below the surrounding noise. "Darren Schultz. He came in on ambulance 3 claiming workplace injury. I don't think he was at the plant." "Emily, I have 40 people waiting. I know. I'm not asking you to stop anything. I'm asking you to flag the name and get someone to verify his employment with Ironfield when you have a moment. Don't let him leave." A pause. "Why?" "Because he's been watching this floor like he's looking for something, and I don't know what yet." She ended the call and moved back into the patient flow. By 1:30 p.m., the acute phase was beginning to shift. The incoming volume had slowed, not stopped, but slowed. And the floor was moving from pure crisis response into the harder, more sustained work of managing what had already arrived. Emily had been on her feet for over 4 hours since walking back through the ambulance bay doors. She had not eaten. She had drunk 2 cups of water from the nursing station. Her shoulders were carrying a tension she would not fully register until later, and her left knee, which had an old injury that reactivated under prolonged standing, was starting to send signals she was choosing to ignore. She was finishing a secondary assessment on a burn patient in Bay 9 when she heard Hale's voice in the corridor behind her. She did not turn immediately. She completed what she was doing, made her notes, and then stepped out of the bay. Hale was standing 10 feet away with Gerald Forsyth from HR. They were speaking at a volume that was designed to be low enough to seem private, but was not, in fact, private. Forsyth had a tablet. They were both looking at it. Forsyth said something about documentation, and Hale said something that included the phrase unauthorized clinical interventions. And Emily understood what she was walking into before she reached them. She stopped in front of them, did not wait to be addressed. There are going to be documentation concerns, she said. I expect that. But right now, 2 of your critical care bays are understaffed for the complexity of the cases in them, and that needs to be addressed before you address me. Forsyth looked genuinely uncomfortable. Hale did not. You performed clinical procedures without authorization, Hale said. A needle decompression in Bay 7. There's no physician order. The physician was occupied and the patient was dying. That's not how it works here. That's how it works everywhere, Emily said. When the alternative is watching someone die while you look for a signature. Hale's jaw moved. You're going to face serious consequences for today. I know. She did know. She had known it when she pulled into the parking lot. She had made the calculation and decided that the consequences were acceptable. They had always been acceptable. That was something about herself she had come to understand over years that had cost her more than she had ever planned to spend. Dr. Hale. The voice came from behind her. She turned. General Stills was crossing the corridor toward them with the measured pace of someone who had decided to enter a conversation he had been observing for long enough. The woman in civilian clothes was behind him. The young officer stayed at the corridor entrance. Hale looked at the uniform. His expression recalibrated automatically, the way people's expressions often did in the presence of military rank, even when they didn't fully understand what rank they were looking at. I'm sorry, Hale said. This is a restricted area during... I'm aware of the situation, Stills said. He stopped beside Emily, not in front of her, not behind her, beside her, which was a positioning choice that was not accidental. My name is Brigadier General Warren Stills. I need 5 minutes with your hospital administrator. Our administrator is not on site today. Then whoever is acting in that capacity. He said it without sharpness, without visible impatience, in the tone of someone who is accustomed to being the last person in a room to raise their voice. This concerns a federal matter related to this facility. It's not a request I'm going to repeat. Forsyth looked at Hale. Hale looked at Stills. Stills looked at neither of them in particular, which was somehow more authoritative than looking at both. I'll get the deputy director, Forsyth said. He left. Hale stayed. He looked at Emily, then at the general, then back at Emily, and she could see the recalculation happening in real time, not understanding yet, not connecting the dots, but aware that a variable had entered the equation that changed the shape of whatever he had been planning. If you'll excuse us, Stills said to Hale. It was polite. It was also dismissal. Hale recognized it and left. Stills turned to Emily. You look tired, he said. I'm fine. I know you're fine. I said you look tired. Those are different things. She exhaled. What is this, General? What's actually happening? He glanced at the corridor, at the nurses moving past, the activity around them, and made a small gesture toward a supply alcove 10 feet away. They moved into it. The woman in civilian clothes followed. Up close, she was younger than Emily had initially thought, late 30s maybe, with the specific careful attention of someone who worked in law or federal oversight. This is Agent Lena Ferris, Stills said. Department of Justice, Public Integrity Section. Emily looked at her. Miss Rourke, Ferris said. She had a measured voice, unhurried. We've been building a case for 14 months. It centers on a procurement fraud network that operated inside military contracting channels between 2016 and 2021. Supply chain theft, falsified inspection records, and a coordinated cover-up that included the destruction of personnel records belonging to people who identified or reported the irregularities. Emily waited. Your name appears in the original whistleblower documentation, Ferris said. The report you submitted in 2019, the one that was officially marked as unsubstantiated and sealed, was not unsubstantiated. It was suppressed. Emily was quiet for a moment. The ER noise moved around the alcove, monitors, voices, equipment rolling across floors, and she stood inside it and processed what she was being told. I know, she said. Ferris blinked. You know. I knew when they sealed it. I didn't have proof, but I knew. She looked at Stills. Is that why you're here? Because the case is finally moving? Partly, he said. What's the other part? He took a breath. Not a hesitation, more of a preparation. The network didn't stay in military contracting. It expanded into civilian infrastructure, Medical procurement specifically. There are 3 hospital systems in the Northwest that have been flagged for connections to the same contractors. Emily's hands stilled at her sides. One of them, he said, is Cascade Ridge Medical Center. She did not react outwardly. She had trained herself not to, years ago, in situations where an outward reaction would have cost her and cost the people around her. She stood in the supply alcove and she let the information settle into place. How connected? She asked. We're still mapping it, Ferris said. But the procurement contracts for Cascade Ridge's imaging equipment and a significant portion of their pharmaceutical supply chain run through a shell company that traces back to the same network. The contracts were set up through the previous hospital director and maintained under the current administration. The current administration meaning people who are still in this building, Stills said. Emily thought about Gerald Forsyth in the HR office that morning, handing her the suspension letter with his hands folded on the desk. She thought about Hale's face during the Denton procedure. Not just annoyance, not just wounded professional pride, but something more specific. The way he had looked at her when she pushed back. The particular quality of wanting her gone. Hale, she said. We don't have his direct involvement confirmed yet, Ferris said carefully. But he's adjacent to people who are confirmed. Ferris did not answer that directly, which was itself a kind of answer. I need to ask you something, Stills said. He was looking at her with the direct, uncomplicated attention that she remembered from before, from the version of their professional relationship that existed before 2019, before the report, before everything that came after. In the 6 weeks you've been here, anything you've observed that seemed wrong, not clinically, administratively, supply discrepancies, unusual purchasing decisions, anything that struck you. Emily thought about it. She went back through 6 weeks of careful, deliberate observation, the kind she did automatically, habitually, in any new environment, a pattern built over years of working in systems where the gaps between what was documented and what actually existed could get people killed. Pharmacy stock, she said. Twice in my first 2 weeks I pulled medications from the dispensing cabinet that had lot numbers inconsistent with the delivery records. I flagged it with the charge pharmacist. She said it was a documentation lag, and it would be corrected. Was it? I never saw the corrected records. Ferris was writing something down. There's something else, Emily said. This morning. A patient came in on the 3rd ambulance from Ironfield. He wasn't injured. He was watching the floor, watching it too carefully. I asked the charge nurse to hold him and flag his name. She paused. Darren Schultz. Something changed in Ferris's expression. Small, controlled, but visible. You know that name, Emily said. Schultz appears in the procurement documentation, Ferris said. He's not an Ironfield employee. He's a logistics coordinator for one of the shell companies. The shape of it assembled in Emily's mind quickly, the way tactical information always assembled when you had enough pieces and the habit of fitting them together under pressure. Schultz had not been at the ER because of the explosion. He had been there because someone had sent him to see what was happening, to understand what the chaos of a mass casualty event might have shaken loose, what might now be visible that was usually hidden. Where is he now? Stills asked. Secondary waiting area. I told security to hold him. Ferris was already moving, reaching for her phone as she stepped out of the alcove. Stills stayed a moment longer. I owe you an explanation, he said, for 2019, for what happened after. Emily looked at him. Yes, you do. I know. He held her gaze. I'm going to give you one. But not here. Not today. I know, she said. Today we do the work. He almost smiled. It was a very small expression, barely there, the kind that didn't quite make it to the surface. But she had known him long enough to recognize the shape of it. She stepped out of the alcove and went back to the ER floor. Ferris returned in 11 minutes. She found Emily at the nursing station and spoke quietly, close enough that the surrounding noise covered them. Darren Schultz was no longer in the secondary waiting area. He had left sometime in the 45 minutes between when Emily had flagged him and when Ferris had gone to find him. The security aide who had been assigned to keep him in place had been redirected by a supervisor to assist with patient transport, and nobody had followed up. He's gone, Ferris said. Emily kept her face level. He saw the general. He saw your credentials. Probably. Then he's already made a call. Ferris looked at the floor for a moment. Yes, probably. Which means whoever sent him knows something changed today. Yes. Emily thought about that. She thought about what it meant for the investigation, what it meant for the people in this building who were connected to the network Ferris had described, and she thought about the fact that panic, in her experience, made people do things that were either very smart or very stupid, and that it was rarely possible to predict which direction any particular person would go. You need to move faster than you planned, Emily said. We're aware. I'm not saying it to tell you your job. I'm saying it because if someone in this hospital starts destroying records tonight, you may lose things you can't recover. Ferris looked at her steadily. What would you do? I'd get eyes on the pharmacy records right now, not tomorrow, tonight. She paused. And I'd find out who redirected that security aide away from Schultz. Ferris was already turning away, phone out again. The afternoon stretched into early evening, and the ER floor gradually found something that was not quite equilibrium, but was at least stable enough that the immediate danger of collapse had passed. The patient census had peaked at 81 and was now declining as discharges began and transfers moved the most critical cases to specialty floors. The nurses who had been running for 6 hours were starting to cycle through short breaks in rotation. Callum Briggs found Emily near the end of the afternoon and stood next to her for a moment without speaking, watching the floor. 14 patients are alive today because of what you did, he said finally. Emily didn't answer immediately. She was watching a nurse across the floor, a young woman named Tara who had been working without rest since before Emily arrived, and who was now sitting in a chair near the supply room with her head against the wall and her eyes closed. Not asleep, just stopped for a moment, the way a machine stops when it needs to cool down. 14 is a number, Emily said. Names are what matter. Briggs was quiet for a moment. You've done this before. It was what he had said to her earlier in the day, in the middle of the first wave. He had said it then as an observation, almost to himself. He said it now as something more deliberate, a question that had been sitting with him through the afternoon and was ready to be asked. Yes, she said. Where? She turned to look at him. He was 28, maybe 29, with the earnest directness of someone who had not yet had that quality trained out of him. He would either keep it or lose it in the next few years, depending on what the hospital did to him. Somewhere you haven't been, she said, and you don't want to have been. He nodded slowly. He seemed to understand that this was not evasion, just the plainest version of the truth she was willing to give right now. What happens to you now? He asked. I don't know. You saved lives today. That has to... It doesn't automatically fix what's broken, she said. That's not how institutions work. They protect themselves first. He looked at the floor. That's a depressing way to see it. It's an accurate way to see it. She moved away from the wall. Go check on Bay 3. The patient there is going to start asking to leave against medical advice, and she shouldn't. He went. Emily crossed the floor toward the administrative corridor. Stills and Ferris had been using a conference room the deputy director had made available to them. A small room with a table and 4 chairs and a single window that looked out over the hospital parking structure. She had passed it 3 times in the afternoon without stopping. She stopped now. She pushed the door open. Ferris was on her phone. Stills was sitting at the table with a manila folder open in front of him and 2 additional folders stacked to his left. The young officer, she had learned his name was Lieutenant Graham Pask, was at the window with his own phone and a notepad. Stills looked up when she came in. She pulled out a chair and sat across from him, and for the first time in 8 hours she let herself stop moving. The knee was now fully audible in its complaint. The tiredness in her shoulders was deep and specific. She set her hands on the table. Tell me what happened to my report, she said. He did not look away. It was intercepted at the processing stage before it reached the IG's office. Someone inside the contracting administration pulled it from the review queue and reclassified it. Who? A deputy contracts officer named Roland Mast. He's been in federal custody for 6 weeks. Emily held that information for a moment. Roland Mast. She did not recognize the name, but she recognized the role. The kind of mid-level administrative position that was invisible enough to be useful, important enough to move paperwork, close enough to power, to protect the people above him while carrying the real exposure himself. He's cooperating? She asked. Partially. Who is he protecting? Stills picked up one of the manila folders and slid it across the table. Emily opened it. There were names inside. She read them without letting her expression do anything. She read them carefully, the way she had learned to read orders in environments where misreading them had consequences. And when she reached the fourth name on the second page, she stopped. She looked up at Stills. He was watching her. "This person had access to my personnel file," she said. "Yes." "This person could have—" She stopped. She looked back at the page. The incident report from the 2019 operation. The one that formed the basis of the investigation against me. "Yes. This person wrote it. Or authorized it," Stills said. "We're still establishing which." Emily set the folder down. She put her hands flat on the table. She had spent 4 years carrying the weight of that report, the one that had ended her military career, not with a dishonorable discharge, but with the administrative equivalent of an erasure, a reclassification of her record that effectively made her unhireable in any federal medical capacity, and deeply complicated in civilian systems that ran security background checks. She had rebuilt something. She had rebuilt it carefully and slowly, in contract nursing positions that didn't look too closely, and travel assignments that kept her moving, and the kind of quiet determination that had nowhere else to go. And now the name of the person who had set that in motion was on a piece of paper in front of her, in a conference room in a hospital in Millerton, Montana. "I need a minute," she said. Stills stood up. He said something to Pask and Ferris, and both of them left the room. He followed them out, pulling the door almost shut behind him. Not fully closed, just enough to give her the privacy of not being watched without leaving her alone in a room with documents she wasn't cleared to be alone with. She sat. She looked out the window at the parking structure. A car was pulling out of level 2. Its headlights swept across the concrete wall in an arc and then disappeared down the exit ramp. 4 years. She had known, in the abstract, that someone had done this deliberately. Knowing in the abstract was different from knowing the name. The abstract version left room for uncertainty, for the possibility that it had been a system failure rather than a choice, that multiple small decisions had accumulated into something nobody had specifically intended. The name on the page removed that possibility. The name on the page was a choice. She closed the folder. She stood up, went to the window, and looked out at the parking structure for another 30 seconds. Then she walked to the door and pulled it open. Stills was standing in the corridor 3 feet away. He had not gone far. "I want to be part of the testimony process," she said. "Whatever it takes. Whatever you need from me." "I know," he said. "That's why I'm here. And I want my record corrected." "That's already in motion." She nodded once. Behind her in the conference room, the folders sat on the table. In the ER beyond the corridor, the floor was quieter now than it had been at noon, but still working, still moving, the tail end of the day's disaster still being managed patient by patient. Marcus Webb was out there. Callum Briggs was out there. Tara, the young nurse who had been stopped against the wall, was back on her feet. Emily started walking back toward the floor. She was halfway there when her radio tag crackled and Marcus's voice came through with a quality she recognized immediately. Controlled but tight, the sound of someone holding something very close to the surface. "Emily, Bay 11. "What is it?" "The patient we moved there an hour ago. The one you triaged from the second wave, abdominal trauma. Stable, as of 2 o'clock. I remember him. His pressure just dropped. Hard. Briggs is in there, but he's asking for you." She was already moving. "And Emily." A pause that had weight in it. "Hale just went into the records room, the main records room. He had his access card and a USB drive." She stopped walking. She turned. The records room was in the opposite direction from Bay 11, down the administrative corridor, past the conference room, past Forsyth's office. At the end of the hall, where the physical and digital records for the last 3 years of patient and procurement data were stored. A USB drive. She turned back toward Bay 11. Her patient. Briggs needed her, and her patient's pressure was dropping, and that was a concrete human life that needed her hands and her judgment right now. She pressed the radio tag. "Get Ferris to the records room. Now. Tell her Hale has a USB drive." She released the tag and ran toward Bay 11. Behind her in the corridor, the conference room door swung open as Ferris came out at speed, already reaching for her own phone, her face carrying the expression of someone whose timeline had just been forced to collapse. The patient in Bay 11 was named Otto Ferris. Emily knew this because she had triaged him herself at 11:20 a.m. a 53-year-old line supervisor from the Ironfield plant who had arrived conscious and talking, complaining of abdominal pain and left flank tenderness following the blast. His initial vitals had been borderline. Blood pressure 102/68, heart rate 104, respiratory rate slightly elevated. She had tagged him for imaging and upgraded him to yellow plus based on his mechanism of injury and the tenderness pattern, which was consistent with possible splenic involvement but not definitively surgical at the time. He had gone to CT at 12:40 p.m. The read had come back as a grade 2 splenic laceration with a small amount of free fluid, serious but manageable conservatively if his pressure held and the bleeding stayed contained. His pressure was no longer holding. Briggs was at the bedside when Emily came through the bay entrance. The monitor showed a pressure of 84/52 and a heart rate of 128, and the trend line on the screen told the story clearly. This had not been a sudden drop. It had been a slow drift that had accelerated in the last 20 minutes, the kind of trajectory that happened when a contained bleed stopped being contained. "When did this start moving?" Emily asked, coming to the other side of the bed. "First dip was around 5:15, Briggs said. He was holding the chart tablet and his jaw was tight. Nurse documented it as a transient response to position change. Pressure recovered slightly, and she didn't escalate." Emily looked at Otto Ferris. He was conscious but pale, the specific gray-white pallor of someone whose body was working hard to compensate for volume loss. And his eyes tracked her when she appeared at the bedside, but his responses were slow. Otto, she said, "I need you to stay with me." His voice was thin. "Hurts more. Since an hour ago." "I know. We're going to take care of it." She turned to Briggs. "He's bleeding. The laceration has extended or the tamponade failed. He needs surgical intervention now. Hale is the attending on his case." She looked at Briggs directly. "Where's Hale?" Briggs already knew the answer, or something close to it. He had been on the floor. He would have seen what Emily had seen. The direction Hale had walked, the timestamp, the fact that nobody had paged him to a clinical emergency yet, because the nurse who had documented the initial pressure dip had not escalated. "Records room," Emily said, because they both knew, and saying it out loud was faster than navigating around it. "I can call him, and get vascular surgery on the phone in parallel, because we are not waiting for him to make a decision." She was already moving, checking Otto's IV access. One peripheral line in the right antecubital, inadequate for what was coming. "I need a second large bore IV, right now. Get me 2 units of O negative from the blood bank on emergency release, and tell the OR we may be coming in the next 10 to 15 minutes. Priya was in the bay again. She seemed to follow the worst situations instinctively, or maybe she had just been assigned to this corridor. She moved to the supply cart without being asked and started assembling what was needed. Emily established the second IV in Otto Ferris's left forearm with the ease of someone who had done it in worse light, in worse conditions, with hands that had not always been steady. Otto made a sound when the needle went in but did not pull away. He was trying to cooperate. That mattered. Patients who were trying to cooperate gave you something to work with. "I'm cold," he said. "I know. The blanket is coming." Priya had a warmed blanket from the cabinet and laid it over him before Emily finished the sentence. Briggs was on the phone at the bay entrance, voice low and fast. Emily could hear him getting pushback from someone, likely the surgical coordinator going through the standard queue process, which was not designed for the kind of day Cascade Ridge had just had. She heard Briggs say the word emergency and then say it again louder. She ran the first fluid bolus. Otto's pressure at the next reading was 79/48. Going the wrong direction, she recalculated. If the laceration had extended to a grade 3 or 4, the free fluid in his abdomen was no longer a small amount. His body had been compensating for hours and was now past the point where compensation was sustainable. He needed an OR, not a bay. Hale had not appeared. Briggs ended his phone call. "Vascular is mobilizing. OR 2 is being cleared." "How long?" 15 minutes? Maybe 20. She looked at the monitor. 15 minutes was a conversation she was going to have very carefully with Otto Ferris's physiology. "Start the O negative," she said. "Run it wide open. And tell whoever is clearing that OR to move faster." Hale arrived in the bay doorway 8 minutes later. He took in the scene, the monitor numbers, the blood hanging, the expression on Briggs's face. and she watched him absorb what had happened in his absence, watched him calculate what it looked like that he had not been paged until now, watched him decide how to position himself in the next 30 seconds. He came to the bedside without addressing Emily. "What's the current pressure?" he asked Briggs. 74/46, Briggs said. Hale looked at the monitor. He looked at the blood drip rate. He looked at Otto Ferris. "We need to move him," Emily said. Hale glanced at her. "I'm the attending on this case." "I know that, and you need to authorize the OR now." "I'm aware of Dr. Hale." She kept her voice flat, clinical, stripped of everything except the information. "He has an extended splenic laceration that is actively bleeding. His pressure has been declining for over an hour. He has less than 10 minutes of meaningful compensation left at this rate. If you authorize the OR right now, we can move him and give him a reasonable chance. If we continue this conversation for another 5 minutes, we are going to be in a different situation." The bay was quiet except for the monitor. Otto Ferris said very quietly, "Please." Hale looked at him. Whatever was moving behind Hale's eyes in that moment was not something Emily could fully read. Guilt, calculation, the pressure of a situation that had outpaced his ability to manage it on his own terms. She did not try to read it. She waited. "Call the OR," Hale said. "Tell them we're coming." Briggs was already on the phone. Well, they moved Otto Ferris to OR2 at 6:02 p.m. Emily walked with the gurney to the OR corridor and then stopped at the line she couldn't cross. She had no surgical clearance, no OR privileges, no standing in that room. She stood at the swinging door and watched the gurney move through it, and then the door swung closed and Otto Ferris was in someone else's hands. She stood there for a moment. The corridor was quieter than the ER floor. The overhead lights buzzed at a frequency she had stopped noticing hours ago and now noticed again. Her knee was a sustained, specific ache from somewhere behind the kneecap. She needed to sit down, and she was not going to, because sitting down right now felt like something she could not afford. She turned around. Ferris was standing at the end of the corridor. Her expression said everything before she opened her mouth. "Hale destroyed files," Emily said. "He attempted to," Ferris said. "He had the USB drive plugged in and had initiated a deletion protocol on 3 years of pharmaceutical procurement records. We interrupted it." "How much was lost?" "We're working with our forensic team to determine what was recoverable. Some of it may be gone." Ferris paused. "He's being detained in the building. My team has him in the administrator's conference room." Emily processed this. He knew. When Schultz saw the general and ran, someone called Hale. "That's our assessment, yes." So he spent the afternoon managing patients while simultaneously knowing his window was closing. It appears so. She thought about Otto Ferris on the surgical table right now. She thought about the afternoon. Hale standing in the bay doorway. Hale looking at the monitor numbers. Hale saying the words, "I'm the attending on this case," with the particular emphasis of someone asserting authority because it was the only anchor they had left. He had kept working. He had kept doing his job while whatever else was happening underneath it ran its parallel course, and she could not decide what to do with that, whether it made it better or worse or simply more complicated. "What happens now?" she asked. "We execute search warrants on the hospital's procurement records, physical and digital. Our forensic accountants will be on site tomorrow morning. In the interim, the deputy director of the hospital has been notified of the federal investigation and has agreed to cooperate." Ferris looked at her steadily. "And we're going to need your formal statement about what you observed in those 6 weeks. The pharmacy lot numbers, the documentation irregularities, everything. Tonight? If you're able." Emily looked down the corridor toward the OR doors. "I need to know Otto Ferris is stable first." Ferris nodded. "Of course." She gave the statement in the conference room where the manila folders had been sitting 3 hours ago. Lieutenant Pask typed while she talked. Ferris asked questions, and Emily answered them with the same methodical precision she used for clinical documentation, specific, sequential, without interpretation or editorializing, letting the facts carry their own weight. She described the pharmacy lot discrepancies. She described 2 instances of supply deliveries arriving with documentation that didn't match what was in the system. She described an interaction in her 3rd week at Cascade Ridge where she had asked the floor supervisor about an unusually low stock of a specific analgesic and been told not to worry about procurement issues. She described watching Hale's clinical decisions over 6 weeks. Not all of them wrong, not all of them suspicious, but a pattern that she had filed away without fully knowing why. The small, persistent sense that some of his choices were being made in a context she didn't have access to. By the time she finished, it was past 8 in the evening. General Stills was still in the building. He was in the corridor outside the conference room when she came out, standing with a cup of coffee he had gotten from somewhere and had probably not drunk more than a third of. "The OR called," he said. "Ferris is out of surgery. They repaired the laceration. He's in recovery." Emily exhaled. "Sit down," Stills said. "I'm fine." "You've been standing for 12 hours. Sit down." There was a row of chairs against the corridor wall, the kind that existed in every hospital corridor, functional and uncomfortable. She sat in one. He sat in the one next to her. For a moment, they didn't say anything. The hospital around them had shifted into its evening rhythm, quieter, slower, the day's crisis now metabolized into paperwork and recovery, and the specific exhausted stillness of a building that had been through something and was beginning to understand what it would take to process it. "You said you owed me an explanation," Emily said. "I did. I want it now." He turned the coffee cup in his hands. She noticed he had not taken off his uniform all day, which was its own kind of statement. He had walked into this building in full dress and had stayed in full dress through everything that followed. Either deliberate or so habitual it was automatic. With Stills, she had never been certain which. "In 2019, when your report came in," he said, "I was aware of it within 48 hours. Through informal channels, someone who worked in the contracting administration told me a report had been flagged for suppression and gave me a general description. I didn't know it was you at first." Emily waited. "When I found out it was you, I went to the IG's office directly to ask why it had been pulled from the review queue. I was told it was under assessment and that there was no indication of irregularities in the report's processing." He paused. "I accepted that answer." "You accepted it?" "I accepted it," he said again, without inflection, without excuse. "I should not have. I had enough standing to push harder. I had enough doubt to push harder. I didn't, and 6 weeks later your record was reclassified and you were out of the service." Emily looked at the opposite wall. "I spent a considerable amount of time afterward," Stills said, "telling myself there was nothing I could have done with more certainty than I had at the time. That getting involved with speculation and incomplete information would have been worse for you, not better." "Was that true?" "No," he said. "It was comfortable." She turned to look at him. It was a striking thing for a man of his rank and his particular kind of professional pride to say, not just an admission, but a specific, unsparing one, the kind that didn't leave room for partial credit. "I'm sorry, Emily," he said. "That's inadequate for what it actually cost you. I know that. I'm saying it anyway because it's the true thing, and the true thing is what you're owed." She sat with that for a moment. She was not going to tell him it was fine, because it was not fine, and she was not going to tell him. It didn't matter, because it had mattered enormously, had mattered in ways that had changed the entire shape of her life since then. 4 years of contract work, 4 years of careful invisibility. The things she had not let herself want because wanting them required a stability she had lost access to. But she was also not going to perform the anger she was entitled to, because performing it didn't get her anywhere useful, and she had never been a person who chose the satisfying thing over the functional one. "Okay," she said. He looked at her. "Not okay as in, it's fine," she said. "Okay as in, I heard you. We can keep going." He nodded once. She pushed herself up from the chair and the knee reminded her loudly of its position on the day's events. She ignored it. "I need to talk to Marcus," she said. "He's been carrying this floor since morning and nobody has debriefed the team. That needs to happen tonight, even briefly." Agreed. She started toward the ER. Then she stopped. "The name on the second page," she said. "The one I recognized. The one who wrote the incident report." She looked back at Stills. "Where are they now?" Stills stood up. His expression closed slightly, the way a door closes when there's something on the other side of it that needs to stay contained for now. "Stateside," he said, "still in their position. They haven't been contacted yet. The investigation is still building the evidentiary chain to that level. Mast's cooperation is partial. We need corroboration." Emily looked at him for a long moment. "And if they find out the investigation has moved, if Schultz or someone else gets a message out that you're here, that you talked to me, We're aware of the risk. Are you moving fast enough? He did not answer immediately, and the pause itself was informative. Move faster, she said, and went to find Marcus. Marcus Webb was in the supply room off the main nursing corridor. Not hiding, he was restocking, moving items from a delivery cart to the cabinet shelves in the methodical way of someone who needed to do something with his hands. Emily came in and closed the door behind her. He looked at her. He looked at her the way people looked at someone they were genuinely relieved was still standing. Ferris made it, she said. He exhaled audibly. I heard. How's the team? Tired. Tara cried for about 20 minutes in the break room around 4 o'clock, and then came back out and finished her shift. Kendrick, the night nurse in Bay 2, is going to need a couple of days before he's back to baseline. The residents, he shook his head slightly. Briggs is fine. He's one of those people who processes by staying in motion. The others I'm less sure about. They need a debrief. Not tonight, but tomorrow. Early. I know. No, I was already planning it. He set a stack of gauze packs on the shelf. Emily. Yeah. What is happening with the federal agents? She considered how much to tell him and decided that Marcus had been in this building for 3 years, that he had been the person who led her back through the door this morning when the hospital had technically suspended her, that he had flagged Schultz's name when she asked, that he had been moving through this day alongside her without full information and deserved more than she had given him. She told him the outline. Not the names, some of those she couldn't share yet, but the shape of it, the procurement fraud, the connection to Cascade Ridge, Hale and the records room, Darren Schultz. Marcus listened without interrupting. When she finished, he was quiet for a moment. The lot number discrepancy, he said. The pharmacy thing you flagged in week 2. Yes. I saw something similar 8 months ago. I thought it was a documentation error. I logged it and moved on. Where did you log it? Internal Quality Improvement System. He paused. Which is administered by the hospital records department. Emily looked at him. Which Hale had access to, Marcus said. She needed to tell Ferris tonight, before the forensic team arrived tomorrow morning, so they knew to look for alterations in the quality improvement records and not just the procurement database. She pulled out her radio tag to call the conference room. Before she could press it, the tag crackled on its own. It was Lieutenant Pask's voice, not Marcus's channel, which meant Stills had given Pask her frequency at some point in the afternoon. Ms. Rourke. Pask's voice was controlled, but there was a sharpness underneath it. We have a situation. Can you come to the main entrance? What is it? A brief pause. Dr. Hale is no longer in the administrator's conference room. Emily went still. He was left with one agent while the rest of the team responded to something on the procurement floor. The agent is currently incapacitated, non-life-threatening injury, but where did he go? Emily asked. We don't know yet. We're securing exits, but the building is large and there are multiple points. How long ago? Approximately 12 minutes. Emily was already moving toward the supply room door. 12 minutes in a hospital building she had been working in for 6 weeks. She knew the layout, she knew the maintenance corridors that bypassed the main hallways. She knew the loading dock on the north side that had a secondary exit. Most of the staff used for smoke breaks because it was faster than the main entrance. She knew the parking structure had a pedestrian stairwell that emerged on the street level of the block behind the hospital. She also knew that a man who had spent the afternoon knowing his window was closing, who had gone to the records room with a USB drive, who had fought her all day over patience and authority and the right to remain in control. That man was not running without a destination. He was going somewhere specific. She thought about what he would need, what he would want to take with him, or destroy before he went. She thought about the quality improvement records Marcus had just told her about. She thought about whether the procurement database was the only place records existed. Pask, she said into the radio. Check the nursing supervisor's office on floor 2. It has a standalone backup terminal for quality improvement records that's not networked to the main system. A pause. Why? Because if he knows about Marcus's 8-month-old log entry, that's where it lives. And if he's trying to destroy evidence on his way out, that's the next target. She pushed through the supply room door. Marcus was right behind her. I'm coming with you. You don't have to. 3 years, he said. I've been in this building 3 years. I'm coming. They took the stairs. Floor 2 was quieter than the ER. The patient ward, post-surgical recovery. The long corridor lined with room doors and dimmed overhead lighting for evening hours. The nursing supervisor's office was at the south end, past the nurses' station and the family waiting area and the window that looked out over the ambulance bay below. They came around the corner at the south end of the corridor. The office door was open. The light inside was on. Emily stopped Marcus with a hand on his arm and moved to the doorway. Hale was inside. He was standing at the backup terminal with his back to the door, his jacket gone, his white shirt untucked on one side, typing fast. He had the posture of a man who knew he was past the point of careful and had arrived at desperate, the kind of body language that was different from urgency, the way a controlled burn was different from a house fire. He heard her come in. He turned. She had never seen his face look like this. Not during the Denton procedure, not during the morning's confrontation, not during the Bay 11 argument with the monitor screaming. This was something new. The specific quality of a person who has spent a long time being certain they were untouchable and has just understood at a molecular level that they are not. Emily, he said, just her name. Like he was trying to locate himself in relation to her. She looked at the screen behind him. The terminal was showing the quality improvement database, the same system Marcus had described, and the deletion confirmation prompt was already on the screen waiting for a final command. One keystroke. Step away from the terminal, she said. He didn't move. Victor. It was the first time she had used his first name. She had always called him Dr. Hale, even in the worst moments. The shift was deliberate, a signal that they were past professional distance. The agents are on their way up right now. Whatever is on that screen is already flagged by the forensic team as a target. Deleting it doesn't make it disappear. It makes you look worse. His hand was on the keyboard. I had a patient, he said. His voice was strange, thin, disconnected, the voice of someone speaking from a place that didn't quite have access to the normal social architecture. A patient who would have died in 2018 without equipment I couldn't have gotten through standard channels. The procurement system was a way to access things faster. That's how it started. I know how it starts, Emily said. He stopped. I was not trying to hurt anyone. People were hurt, she said. Some of them today. In this building. His hand was still on the keyboard. She heard the stairwell door at the end of the corridor bang open. Pask. And from the sound of it, at least one other person moving fast. Hale heard it too. His hand moved toward the keyboard. Emily crossed the room in 4 steps and put her hand over his, pressing it flat against the desk surface before his fingers could reach the keys. And they stood like that for a moment. Her hand on his, the terminal screen glowing behind him, the footsteps getting louder in the corridor. And she felt him stop. Not because she was stronger, she was not certain she was, but because the stopping point had arrived and some part of him, whatever part still operated on something other than pure survival reflex, recognized it. He did not press the key. Pass came through the door with another agent behind him. Emily stepped back. She moved out of the way and let the process take over. The process she had spent years distrusting, years working around, years watching fail the people who most needed it to function. She stood against the office wall and watched them take Hale out of the room, watched his face as he passed her in the doorway. And there was a moment where his eyes met hers, and she saw something in them that she did not have a clean name for. Not remorse exactly. Something prior to remorse. The very beginning of the understanding that consequences were no longer theoretical. He was gone. Marcus appeared in the doorway. Emily looked at the terminal. The deletion prompt was still on the screen, waiting. She looked at it for a long moment, and then she called Ferris on the radio and told her the terminal was intact and someone needed to secure it immediately. While she waited, she stood in the quiet office and noticed that her hand, the one she had put over Hale's, was shaking slightly. Not a lot. Just a small, fine tremor in the fingers that she had not given herself time to notice until now. She made a fist and released it. And then her phone rang. Not the radio, her personal phone, in her scrub pocket. The number she gave only to people who had it for specific reasons. She pulled it out. Unknown number. Montana area code, but not one she recognized. She answered. There was a pause on the line, then a voice she did not recognize. Low, male, precise in the way that people who had been trained to communicate under pressure were precise. Miss Rourke, the voice said. My name is not important right now. What's important is that the person you've been looking for, the one whose name was on the second page of that folder, knows you identified them. They've been notified in the last 2 hours. Emily's hand tightened on the phone. They're not waiting for the investigation to reach them, the voice said. They're moving tonight. Who is this? Emily said. Someone who made the same mistake General Stills made in 2019, the voice said. And who is trying to not make it again? A pause. The name you need is Brigadier General Carla Voss. She landed at Malmstrom Air Force Base 40 minutes ago, and she is not there for routine business. The line went dead. Emily stood in the nursing supervisor's office with a dead phone line and a name she had not known 20 seconds ago. Brigadier General Carla Voss. She said it quietly, to herself, testing the shape of it. The name meant nothing to her yet. No face attached, no history, no context beyond what the voice on the phone had given her. But the voice had known her name, had known about the folder, about the second page, about what she had identified in that conference room. That kind of specific knowledge did not come from guesswork. She walked out of the office and found Stills at the end of the corridor. He was standing near the stairwell door with Pask, speaking in low tones, watching 2 agents escort Hale toward the elevator. When he saw Emily's face, he stopped speaking mid-sentence. She crossed the corridor and told him what the caller had said. All of it, in the same order she had received it, without interpretation. She had learned a long time ago that the first time you delivered intelligence, you delivered exactly what you had, and you let the person receiving it do the initial assembly. Stills listened without interrupting. When she finished, he was quiet for a moment that was distinctly different from normal quiet. It had a texture to it, a density, the quality of a person rapidly reconfiguring everything they thought they understood about the current situation. Voss, he said, you know her. I know of her. She's 3 levels above my current assignment. Joint Logistics Oversight, with a history in contracting administration. He paused. She was deputy director of the contracting office in 2019. Emily held his gaze. She was Roland Mast's supervisor. Yes. She's the one who authorized the suppression of my report. Stills looked at her for another moment, and then turned to Pask. Get Ferris, now, and get me a secure line to the IG's office. I don't care what time it is there. Pask moved fast. Stills turned back to Emily. He looked like a man recalibrating not just the tactical situation, but something more personal. The realization that the person who had been at the top of the chain this whole time was someone he had been proximate to for years, someone in whose professional orbit he had moved, someone whose name he had probably seen on documents and memos and oversight reports without the particular attention that name now demanded. She landed 40 minutes ago, Emily said. Whoever called me, they seemed certain she was moving tonight. Moving toward what? I don't know, but Malmstrom is 2 hours from here. Less if you're traveling with military transport resources. They looked at each other. What does she need? Emily said. If she's running, what does she come here for first? Evidence, Stills said immediately. The same thing Hale was trying to destroy. But Hale is small. Hale is one node. Voss would know what the forensic team can and can't recover. She would know which physical records matter, which archive systems aren't fully networked, which documentation exists in formats that can't be reconstructed from digital backup. The contracts themselves, Emily said. The original signed procurement contracts. Physical copies. Where would those be? Stills looked at Pask, who had reappeared with Ferris coming fast behind him. Ferris heard the last exchange. She did not need it repeated. She pulled out her own phone and was already talking before she fully stopped walking. Emily heard her say the word Voss and watched the micro-response on Ferris's face, a slight contraction around the eyes that confirmed the name was not new to her. You knew about Voss, Emily said when Ferris ended the call. She was a person of interest at the investigation's perimeter, Ferris said. We hadn't established direct evidentiary connection yet. Mass partial cooperation was getting us there, but she found out the investigation was closing in. Apparently. Ferris's voice was controlled in the way of someone managing something they were not going to let turn into panic. The physical contract files for Cascade Ridge's procurement agreements, the original signed copies, are in the hospital's legal records vault on the basement level. It's not accessible from the main corridors. You need a specific administrative key and a secondary PIN. Who has access? The hospital director, the deputy director. And the Legal Affairs Office? Ferris paused. The Legal Affairs Office was closed at 5 p.m. today. The deputy director has been cooperating with us and has been in the administrative suite since this afternoon. But there's a third key. Emily waited. The outgoing hospital director, Ferris said, who left the position 8 months ago under what was described as a voluntary retirement. And whose departure was almost certainly not voluntary, Emily said. No, probably not. Does the outgoing director still have their key? According to procedure, it should have been returned and deactivated. According to procedure. Emily had spent 6 weeks in this building and had developed a specific sense of how closely this particular institution followed its own procedures. Check, she said. Right now. Confirm whether that key was actually deactivated or just marked as deactivated in the system. Ferris was already on it. The basement level of Cascade Ridge Medical Center smelled like every hospital basement Emily had ever been in. A combination of cleaning chemicals, recycled air, and the particular institutional cold that came from being below ground in a Montana winter. The legal records vault was at the end of a concrete corridor past the facilities management office and the biohazard waste processing room. Stills had insisted on accompanying them. Ferris had sent 2 agents ahead to secure the corridor. Pask was coordinating with Malmstrom, attempting, through channels that were apparently more complicated than they should have been at 9 o'clock on a Tuesday night, to get confirmation of whether a brigadier general named Carla Voss had in fact arrived at the base and under what authorization. The deputy director of the hospital, a man named Howard Pellegrini, who had the look of someone who had aged 10 years in the last 8 hours, met them at the vault door with his key card and the expression of a person who was cooperating because cooperation was the only remaining option, and he understood this with complete clarity. I need to know, Pellegrini said to Ferris, whether my cooperation is being documented, formally. It is, Ferris said, and the degree to which I was aware of the procurement issues will be addressed through the formal process, Ferris said. Not a promise, but an acknowledgement. Pellegrini seemed to understand the distinction and accepted it. He used his keycard and entered the PIN. The vault door released. The room inside was smaller than Emily expected, 12 feet by 8, with metal shelving units along 3 walls and a central table that was bolted to the floor. Archival boxes in standardized sizes, labeled by year and contract category. A fireproof filing cabinet on the far wall. Everything organized with the kind of meticulous bureaucratic precision that existed in inverse proportion to the content's integrity. Ferris and one of the agents began working through the boxes with the systematic attention of people who knew exactly what they were looking for. Emily stood near the door and watched. She was useful in clinical spaces. She was less useful in evidentiary ones, and she knew her limits well enough to stay out of the way when she was past them. Her phone vibrated. A text from an unsaved number, the same Montana area code as the call. One line. She's not coming for the vault. She's coming for the witness. Emily read it twice. She looked up at Stills. We need to talk, she said. Outside. In the corridor, she showed him the message. He read it. His face did the closed door thing again, that particular quality of containment. But there was something else underneath it this time, something that looked, if she was reading it correctly, like the specific concern of a person who has just realized that the threat vector has shifted from an institution to an individual. The witness, he said. Mast, she said. Roland Mast. He's cooperating, partially. He's the primary evidentiary link to Voss. He's in federal custody. Where? Stills was already pulling out his own phone. She watched him make the call. She watched his face while he waited for someone to pick up, and she watched it while he spoke. And she watched the moment when something in the response he received changed the quality of his stillness, from focus to something that had an edge in it. He ended the call. Mast was transferred 2 days ago, he said. Standard procedure. Facility rotation to manage security risk. His current location should be classified. Should be. The transfer documentation was processed through the Joint Logistics Administration Office, Stills said, which falls under Voss's oversight. The logic of it assembled itself cleanly and horribly. Voss had known about the investigation's movement not just because someone had tipped her off tonight. She had been tracking it for weeks, maybe months, from inside the administrative structure that was supposed to be investigating her. She had access to transfer documentation. She potentially had access to Mast's current location. She's not destroying evidence, Emily said. She's eliminating the witness. Stills was already walking, phone to his ear, his stride carrying the contained urgency of someone who had shifted from assessment to action. Emily went with him. Back in the vault room, Ferris looked up when they came in and read their expressions in approximately 1 second. "Tell me," she said. Stills told her. Ferris listened and then did something Emily had not seen her do all day. She said something short and profane under her breath, just once, and then assembled her professional composure back into place like someone picking up dropped tools. "I need a secure line to the Marshal's service," she said to Pask. "Right now, not through the standard relay." While Ferris made contact and began navigating the specific bureaucratic obstacles that existed when one federal agency needed to reach another at 9:15 on a Tuesday night with an urgent request that did not fit any standard protocol, Emily stood in the vault room and thought. She thought about Carla Voss, a person she had never met and whose face she still did not know, landing at Malmstrom 40 minutes ago. Closer to an hour now, with resources and military transport at her disposal and a very specific objective. She thought about the shape of what Voss was trying to accomplish. Not a chaotic flight, not a panicked run. Something more deliberate. The systematic removal of the pieces that could be used against her. Hale destroying procurement records here. Voss moving en masse somewhere else. A coordinated withdrawal, except Hale had failed, and Voss didn't know it yet. "She thinks Hale got the files," Emily said. Ferris looked up from her call. "She sent Schultz this afternoon to monitor the situation. Schultz saw the general and ran. He called someone, Voss or an intermediary, and reported that federal agents were present. Then Hale went to the records room." Emily paused. "But Schultz left before we interrupted Hale. He doesn't know Hale failed. Voss may not know." "Which means she thinks the hospital end is contained," Ferris said slowly, "and she's focused entirely on Mast." Ferris put her phone down. A silence in the room. "If she thinks the hospital evidence is gone," Stills said, "and she removes Mast, she has breathing room," Ferris said. "Not indefinitely, but enough to build an alternative account of events, use her position to redirect the investigation, potentially shut it down from the inside." She looked at Ferris. "We have a window where she doesn't know how much we have." "How long?" Emily asked. "Until Hale reaches a processing facility and someone with access to that information passes it to the wrong person. Hours. Maybe less." The next 40 minutes moved in the particular compressed way of operational time. Not fast exactly, but dense, each minute carrying the weight of several. Ferris coordinated with the Marshal's service through the secure line Pask had established, navigating the jurisdictional geography of a situation that crossed military and civilian federal authorities in ways that did not have a clean procedural template. Stills worked his own channels. Military police, the base provost marshal at Malmstrom, contacts he had accumulated over a career that had apparently involved knowing the right people in enough places to be useful in a situation exactly like this one. Emily was not in those calls. She was not a federal agent or a military officer. She was a suspended nurse in a hospital basement with a 6-week employment history and a cleared but not yet formally reinstated military record, and her role in whatever happened next was going to be determined by people who had more institutional authority than she did. She accepted this. She had learned, over years of operating in systems that were larger than any individual within them, that accepting the limits of your role was not the same as being passive. It meant working effectively within the space you actually had, rather than spending energy on the space you didn't. She went back upstairs. The ER floor was quiet in the specific way of a late Tuesday evening. A handful of non-emergency cases, the night shift settling in, the aftermath of the day visible in the small signs that something unusual had occurred, equipment carts that hadn't been fully restocked, paperwork on the central station that was deeper than normal, the particular careful movement of nurses who were tired in a way that went beyond the standard end-of-shift variety. Marcus was still there. She had expected him to have gone home. He had been on since the morning. He was at the central station reviewing patient handoffs for the night team, and he looked up when she appeared. "You should go," she said. "In a while." He set down the chart he was holding. "How bad is it? Whatever is happening downstairs?" "It's moving," she said. "That's all I can tell you." He nodded. He had learned, through the course of the day, to accept that answer from her. She sat down at a spare chair at the station. The first time she had sat down without intention in, she looked at the clock, 14 hours. The chair was standard issue, the same chairs that existed at nursing stations in every hospital she had ever worked, and the specific physical relief of sitting after 14 hours of standing was intense enough that she had to deliberately moderate her response to it, keep her spine straight, keep her expression the same, because Marcus was watching and she was not ready to let the day fully arrive yet. "Your badge," Marcus said. She looked at him. He slid a piece of paper across the station counter. It was on hospital letterhead, and it had Gerald Forsyth's signature at the bottom. She read it. It was a temporary reinstatement authorization, pending formal review, noting that the disciplinary committee was reopening the matter in light of the day's events. The language was careful and non-committal, the language of an institution hedging, but the practical effect was clear. "When did this happen?" she asked. "About an hour ago. Forsyth brought it to me. He was very—" Marcus paused, selecting the word carefully. "Subdued." She set this paper down. She thought about Gerald Forsyth that morning, handing her the suspension letter with his hands folded. She thought about the calculation he had made then, and the different calculation he was making now. She did not have particular anger about the recalculation. Institutions protected themselves. People inside institutions made decisions that aligned with institutional safety. That was not surprising. It was predictable. The anger she had, the real anger, was for the years before today. The longer pattern, the systematic thing, the name on the second page. Carla Voss. Her phone buzzed. Stills. "We have Mast's location confirmed," he said. "The marshals have him secure. Voss's transport departed Malmstrom 20 minutes ago. We believe she's heading toward Great Falls. That's the nearest facility to Mast's transfer location. Are you coordinating with the marshals to intercept?" "Ferris is. There are—" A pause that contained something complicated. "There are jurisdictional elements. Voss still holds active military rank. Detaining a general officer requires specific authorization from the chain above her, which she has influence over, which is being navigated," Stills said carefully. "Warren." It was the first time she had used his name without the rank. He did not comment on it. "She cannot reach Mast. I know. Whatever jurisdictional navigation is happening, it needs to be resolved before she gets there." "I know," he said again. A pause. "Emily, there's something else." She waited. "The partial cooperation from Mast," he said. "What he's given us so far. It implicates Voss directly in the suppression of your report. Document alteration, unauthorized record reclassification, and what appears to be deliberate targeting of your personnel file." "I know." "What you don't know," he said, "is that Mast also gave us a secondary name. Someone who wasn't in the original procurement network but was brought in specifically to manage the 2019 suppression operation. Someone who interfaced directly with the personnel record system." Emily stood up from the chair. "He's prepared to give that name formally," Stills said, "in testimony, but only if he's physically secure and the immunity negotiation goes through the correct channel." "Then keep him secure," she said. "We're doing everything we can." A pause. "I want you to know the secondary name. When it comes out formally, it's going to recontextualize some things. About who knew what in 2019. Something in the way he said it made her go still. "How many people knew?" she said. "Not a question exactly." "More than I understood at the time," he said. "That's all I'll say tonight." She ended the call and stood at the nursing station and looked at the ER floor in front of her. The quiet movement of the night shift. A patient in the waiting area reading something on their phone. The overnight security guard making his first pass along the main corridor. Normal hospital night, the kind of ordinary institutional rhythm that existed whether the day had been disastrous or unremarkable, because the institution kept moving regardless. She thought about what Stills had said, more than I understood at the time. She thought about what it meant for the shape of the next days and weeks. The testimony, the formal proceedings, the particular exhausting work of watching a cover-up disassemble in the slow motion of official process. She thought about the secondary name she didn't have yet. She thought about Carla Voss in a military transport somewhere between Malmstrom and Great Falls, moving toward a man she needed to silence, not yet knowing that the hospital end of her plan had failed, not yet knowing that the window she thought she had was smaller than she believed. Her phone buzzed again. Not Stills this time. Ferris. We have a problem, Ferris said. Emily turned away from the nursing station. What? The authorization to detain Voss. It was submitted through the correct chain 40 minutes ago. It should have been processed by now. Ferris's voice was careful in the specific way of someone managing escalating concern. It hasn't been. Why not? The duty officer who received it is not responding. The backup authorization contact is also not responding. A pause. Both of them fall under the administrative chain that Voss oversees. Emily understood what Ferris was saying. She has people holding the authorization. It appears so, which means she still has time. She has approximately 40 minutes before she could realistically reach the facility where Mast is being held, Ferris said. We are working every parallel channel we have, but if the authorization doesn't come through, what does the marshal on site do? Holds position and waits for authorization to act, standard protocol. Even if a general officer with potential intent to interfere with a protected witness shows up at the door. The marshal cannot detain an active duty general officer without the authorization. That's not a gray area. Emily turned this over. 40 minutes. A marshal who could hold position but not act without paperwork that was being held up by the very network they were trying to dismantle. A witness in a room who was the evidentiary linchpin for everything. Hale, Voss, the procurement network, the suppression of Emily's report, the secondary name they didn't have yet. There has to be a channel that bypasses Voss's oversight, Emily said. Something she can't reach. We're looking. Look faster. She ended the call. Marcus was watching her from the station. He had heard enough of her half of the conversation to understand that something was still in motion, that the day was not finished. Is there anything I can do? He asked. She looked at him. 3 years in this building. A charge nurse who knew every system, every shortcut, every person. The hospital's legal counsel, she said. Do you know if they have a direct contact with the State Attorney General's office? Not through the standard administrative channels, a personal contact. Marcus thought for a moment. The senior legal counsel, Patricia Okafor, she's been here 12 years. She has a relationship with the AG's office from a malpractice case 3 years ago. He paused. Why? Because the State Attorney General is not in Voss's chain of command, Emily said. And the AG's office can file an emergency motion through a federal district court that doesn't touch the military authorization chain. She watched Marcus work through the logic. It's a long shot, she said. It takes time we may not have, and it may not be sufficient to stop a general officer from entering a federal facility. But it's a channel Voss hasn't thought to block. Because she doesn't know about Patricia Okafor. Because she's been planning this from a military framework, Emily said. And she forgot about the civilian infrastructure around the edges. Marcus was already reaching for the phone. While he dialed, Emily moved to the window at the end of the nursing station corridor, the one that looked out over the ambulance bay and the parking lot beyond it, and in the far distance, the darker mass of the mountains against a night sky that had cleared since the morning's overcast. The smoke from Ironfield was gone, or had at least dispersed into something invisible in the darkness. The plant was still a crime scene, still being processed, still yielding whatever it was going to yield about what happened in those first terrible minutes. 81 patients. Otto Ferris in recovery on the surgical floor, the man with the arm injury who hadn't wanted to be treated, the woman with the airway obstruction in the third ambulance. 14 people that Callum Briggs had counted with the specific quiet awe of someone tallying something they had not expected to be able to tally. She heard Marcus on the phone behind her, patient, specific, making the case to whoever answered for why Patricia Okafor needed to be woken up if she was asleep, why it mattered tonight and not tomorrow morning. Her own phone buzzed, stills again. The authorization came through, he said, 30 seconds ago. I don't know which channel finally moved it. Ferris is still working 2 others simultaneously. But it came through. Through the military chain? Yes. Someone above Voss's oversight level apparently decided the situation warranted direct action. He paused. The marshal on site has been notified. They're in position. Emily exhaled slowly. Voss is still en route, Still said. She doesn't know yet. When does she find out? When she arrives. Emily turned away from the window. Marcus was still on the phone. She caught his eye and shook her head slightly. Not yet. He stayed on the call, holding the position, because this was Marcus, and he understood that you did not stand down until you were certain. The next 17 minutes passed in an almost suspended silence. Emily sat back at the nursing station chair. She did not look at her phone. She watched the ER floor. A night nurse was checking in a patient with a possible fracture from a separate, unrelated incident. Someone's ordinary Tuesday night emergency that had nothing to do with Ironfield or Voss or procurement fraud or any of it. The ordinary machine of the ER running in parallel to everything else, indifferent and necessary. Her phone. Ferris this time. She arrived at the facility at 10:47 p.m., Ferris said. She identified herself, presented her credentials, and requested access to the witness in protective custody. The marshal on site denied the request and presented the detainment authorization. A pause. Brigadier General Carla Voss is currently in federal custody. Emily did not feel what she had expected to feel. Not relief exactly. More like the particular absence of the weight she had been carrying since the phone call in the nursing supervisor's office. The specific muscular relaxation of a body that has been braced against something and is now being told it can stop bracing. Is Mast secure? She asked. Mast is secure and unharmed. Okay, she said. The authorization for Voss's detainment names the charges provisionally as obstruction of a federal investigation, witness tampering, and conspiracy, Ferris said. Additional charges pending review of the full evidentiary record. The secondary name, Emily said. The person Mast is prepared to identify. When does that happen? Formal testimony is scheduled for Thursday morning, Ferris said. We're moving fast to make sure the chain of custody for that testimony is airtight. A pause. Emily, the secondary name, General Stills told me he gave you some indication that the testimony will be significant. He did. I want to make sure you're prepared for the scope of it. Ferris's voice had the careful quality of someone navigating between professional responsibility and something more human. What Mast is prepared to testify about the 2019 suppression operation, the number of people involved, their positions, it's not going to be comfortable information. Emily looked across the ER floor. More than Stills understood at the time, she said. Yes. People he trusted. Some of them. She absorbed this. The day had already required her to absorb a great deal. She found she had more capacity left than she would have predicted, though she could also feel the edges of it, the point beyond which she was going to need time and space to process things she had not yet been given time to feel. I'll be ready for Thursday, she said. She ended the call. Marcus had gotten off his phone at some point during the Ferris call. He was sitting across the station, watching her with the patient attention of someone who had decided a long time ago that she would tell him what she could when she could. It's over? He asked. Part of it, she said. The part that was happening tonight. He nodded slowly. Across the ER, the night nurse finished checking in the fracture patient and walked him toward imaging, talking to him in the calm, reassuring manner of someone who had done this 10,000 times. The security guard made his second corridor pass. The monitor at the central station showed a census of 11 patients, the lowest it had been since 7 a.m. Emily sat in the chair and felt the day settle onto her in full, all at once, the way it always arrived when there was finally nowhere urgent to go. The knee, the shoulders, the particular hollow exhaustion behind her eyes, the memory of her hand over Hale's hand on the desk, the tremor in her fingers afterward, the name on the second page, the voice on the phone she still didn't have a face for, the moment she had pressed a needle into a man's chest and listened to the air release and known, with the particular certainty of someone who has done it before, that he was going to live. Her badge was still on Forsyth's desk. She should go get it. She pushed herself up from the chair. She walked down the corridor toward the administrative offices, her footsteps quiet on the linoleum, the hospital breathing around her in its slow nighttime rhythm. She passed the elevator. She passed the door to the stairwell where she and Marcus had run 3 hours ago. She passed the window that looked out over the parking structure. She stopped. There was a car in the visitor lot that had not been there an hour ago. Mid-sized sedan, Montana plates, parked in the far corner under a light that had been out for as long as she had worked at Cascade Ridge. The engine was running. She could see the exhaust in the cold air. She looked at it for a long moment. She had no particular reason to find it suspicious. People sat in cars and hospital parking lots for all kinds of reasons, none of them sinister. Waiting for a family member, making a phone call. Delayed in the kind of ordinary grief or fear that people brought to hospital parking lots in the middle of the night. She kept looking. The driver's window came down slightly. She could not see the face inside from this distance and this angle, but whoever was sitting in that car was looking directly at the window where she was standing, looking at her. She stood at the window for another 4 seconds. Then she walked to the stairwell, went down one floor, crossed the lobby, and pushed through the main entrance into the cold Montana night. The air hit her like a correction, sharp, clean, the kind of cold that clarified rather than punished. She crossed the visitor lot without rushing. Her footsteps were audible on the asphalt, and she did not try to make them otherwise, because whatever was in that car had already seen her at the window, and the element of surprise had never been available. She stopped 10 feet from the sedan. The driver's window came down the rest of the way. The man behind the wheel was somewhere in his late 50s, with the weathered, deliberate face of someone who had spent a career making decisions in rooms where the decisions mattered. I was not in uniform, civilian clothes, a dark jacket, a look about him that was neither threatening nor entirely comfortable. He was watching her the way people watched things they had thought about from a long distance for a long time. "Ms. Rourke," he said. "You called me earlier," she said. It was not a question. She recognized the voice now that she heard it without the phone compression. The same measured precision, the same quality of someone who had learned to say exactly what was needed and nothing additional. "Yes," he said. "Who are you?" He looked at her for a moment. "My name is Dennis Harlow. I was the Deputy IG for military contracting from 2017 to 2021. She let that land. "You were in the office that should have processed my report," she said. "Yes." "And you're the person who told me about Voss tonight?" "Yes." She stood in the cold and looked at him and did not say anything, because there was a specific kind of conversation that could not be rushed, and this was one of them. A man sitting in a dark parking lot at 11 o'clock, who had driven or flown from wherever he had been to be here, who had her number from sources she didn't know, who had made a call that had changed what happened tonight. This was not a conversation she was going to compress. "You said you made the same mistake Stills made in 2019, she said. "I did, with the difference that I made it from closer in." He looked at his hands on the steering wheel for a moment. "I knew your report had been pulled from the review queue. I knew it within 72 hours. I had enough standing to escalate it to a level above Voss's influence, and I made a calculation that the political cost was too high. You had evidence of suppression, and you chose not to act. I had indicators, not evidence. I told myself that was the distinction that mattered." He paused. It wasn't. Emily's hands were cold. She had come out without her jacket, and the temperature was in the low 30s, and she was registering it now in a way she had not when she first stepped outside. "Why are you here?" she asked. "Because on Thursday, when Mass testifies formally, my name is going to appear in the record," Harlow said. "Not as a principal, but as someone who had knowledge and failed to act. I would rather you hear that from me than from a legal document in a room where I'm not present." He looked at her. "And because I owe you that, at minimum." She stood in this parking lot with the cold coming through her scrub top, and she looked at this man who had made a decision in 2019 that had cost her 4 years of her life. And she thought about what she wanted to say to him, and whether what she wanted to say was also what she needed to say. "Did you drive here from where you live?" she asked. He blinked at the shift. "Flew into Great Falls this afternoon. I've been sitting here for an hour." "Why didn't you come inside?" "I wasn't sure you'd want me to." She exhaled. The breath was visible in the cold air, a small white plume that dispersed and was gone. "I don't know what I want from you yet," she said. "I haven't had time to figure it out. But I'm not going to stand in a parking lot in November while I work through it." She looked at him. "Come inside. I'll buy you coffee from the machine on the second floor. It's terrible. And we'll talk." He got out of the car. The coffee was, in fact, terrible. They sat in the family waiting area on the second floor, which was empty at this hour, and Harlow held his cup without drinking from it, and Emily held hers and did drink, because she needed the caffeine regardless of the quality, and her body had stopped being selective about such things approximately 8 hours ago. He told her what he knew. Not everything. He was careful, precise, aware that formal testimony and informal conversation occupied different spaces, and that conflating them would not serve either of them. But enough. He described the internal culture of the IG's office during the relevant period, the specific pressure points that Voss had known how to manipulate, the way decisions that seemed individually defensible had accumulated into something collectively indefensible. He described watching Emily's record get reclassified and telling himself it was an administrative matter outside his immediate jurisdiction, and knowing, at some level he did not examine too closely at the time, that this was not true. Emily listened. She did not make it easy for him by offering reassurances or softening the silences. She had not come downstairs for his comfort, but she had come downstairs, and that was something. "What happens to you on Thursday?" she asked. "I don't know precisely. I've been cooperating with the investigation for 6 weeks. My attorney believes the cooperation, combined with the fact that I'm not implicated in the original procurement fraud, will result in a negotiated outcome." He looked at her. "I'm not going to keep my position. Whatever else happens, that's already decided." "Were you still in the position when you called me tonight?" "No, I resigned 3 weeks ago." A pause. "After Mass started cooperating and it became clear the investigation was moving toward the suppression chain, I resigned and retained counsel. Tonight I acted in a personal capacity." She nodded. "The person Mast is going to name on Thursday," she said. "You know who it is?" "Yes." "Is it someone I know?" "No," Harlow said. "It's someone inside the personnel records system, a civilian administrator who processed the actual file alterations on your record. Someone who did it because Voss asked, because Voss had leverage, and who has been living with that decision for 4 years." He paused. "She contacted the investigators herself 2 weeks ago, before Mast named her. She came forward." Emily looked at him. "She had a daughter who recently joined the service," Harlow said. "She said she didn't want her daughter to work in a system she hadn't tried to fix." He set his coffee down. "I don't know what to do with that. I'm not sure it changes anything she did, but I thought you should know it." Emily sat with that for a moment. A woman she had never met, who had altered her record under instruction from a general officer with leverage over her career, who had come forward because of her daughter. The human machinery behind the institutional act. The specific, imperfect, comprehensible humanity of someone who had done a wrong thing for reasons that were not simple and had then, eventually, tried to undo them. She did not find it comfortable, but she found it true. "I'm going home," she said. "I've been here since 8 this morning and I need to sleep." She stood up. "You should find a hotel. Stay in Millerton through Thursday. The investigators may need to reach you." "I know." He stood too. He looked at her with the expression of a man who had prepared for worse and received something he had not prepared for, which was neither forgiveness nor condemnation, but simply the acknowledgement that she had heard him and would deal with the rest in her own time. "Thank you," he said, "for coming outside." "Don't thank me yet," she said. "I still don't know what I think about you." She left the waiting area and went to retrieve her badge from Forsyth's office. She slept for 9 hours. She did not expect to. She expected to lie on the mattress in the minimal apartment with the old carpet smell coming through the heating vent and rotate through everything the day had deposited in her, and get perhaps 3 hours of fragmented rest before her body gave up on sleep entirely. Instead, she was unconscious within minutes and did not surface until the light coming through the blinds had the quality of mid-morning, and when she woke up, she lay still for a moment and catalogued what she felt. Sore. The knee was speaking at full volume. Her shoulders had developed specific knots that would take days to work out. She was hungry in a way that suggested her body had been too busy to remind her yesterday and was now presenting the accumulated invoice. Underneath all of that, something else. Quieter. Not peace exactly. Too much was still unresolved. Too many processes were still in motion. Too many things she had learned in the last 24 hours had not yet been fully absorbed. But something adjacent to it. The particular stillness of a person who has done the thing they were there to do. She made actual coffee and actual food, eggs, toast, the kind of unremarkable breakfast that existed purely to be fuel. And she sat at the small table by the window and ate without looking at her phone for 20 minutes. Outside, Millerton was doing what small cities did on Wednesday mornings. Traffic on Route 9. A delivery truck double-parked on the commercial strip she could see from the window. The mountains in the distance, the same mountains they had always been, white at the peaks, indifferent to human events in the valley below. Her phone, when she did look at it, had 11 messages. Stills, Ferris, Marcus, Callum Briggs. Her placement coordinator, Sandra, who had apparently heard something through channels Emily could not fully account for. Her sister in Portland, who had seen news coverage of the Ironfield explosion and was checking in, which was a conversation Emily would need to have today, but was not ready for yet. 2 messages from unknown numbers she would not respond to. A message from the hospital's HR director with language about the formal reinstatement review process. And a message from a number she didn't recognize that identified itself as the office of the Army Inspector General. She looked at that last one for a moment, then she called Stills. "The IG's office reached out," she said when he answered. "I know. I spoke with them this morning." His voice was different from last night, more settled, less operational. The voice of someone who had slept, or at least had a few hours to transition from crisis mode to whatever came after. "They want to schedule a formal interview as part of the personnel record review process. Your case is now active, Emily. Not pending, active. The evidence Mast has provided, combined with the documentation Ferris's team recovered from Cascade Ridge, is sufficient to initiate a full reinstatement review." She set down her coffee cup. "How long does the review take?" she asked. "In a case this straightforward, weeks, not months. The evidentiary record is substantial, and the suppression chain is documented. This is not a close question." A pause. "I want to be honest with you. There will be process. There will be paperwork and interviews and a formal hearing. It won't happen overnight, but the outcome is not in doubt." "You're confident about that?" "I'm confident about that," he said, without the hedging qualities she might have expected from a man who had learned in the last 24 hours that his confidence in institutions had limits. He said it as a specific, measured thing. "The record will be corrected. Your service will be formally recognized. The classification of your 2019 separation will be reversed." She looked out the window at the mountains. "There's also the matter of formal commendation," Stills said, "for what you did yesterday at Cascade Ridge. General Hargrove, the officer who processed the detainment authorization for Voss last night, has already submitted a preliminary notation. The Army wants to—" "One thing at a time," she said. "Of course." She ended the call and finished her coffee and got dressed. Thursday came with overcast skies and the kind of cold that suggested the first real snow of the season was close. Roland Mast's testimony was delivered in a secure federal facility in Helena, 40 miles south of Millerton. Emily was not in the room. She was not a party to the formal proceedings, not yet, but she was in the building. Ferris had arranged it, understanding without being asked that there was a difference between legal standing and human standing, and that Emily had earned the second one regardless of the first. She sat in a waiting room on the second floor and read without retaining much of what she read, and at 11:40 a.m. Ferris came out and sat across from her. "The secondary name," Emily said. "Marilyn Tross," Ferris said. She was a civilian records specialist in the Army Personnel Administration system from 2016 to 2022. She confirmed under testimony that she was instructed by General Voss to alter and reclassify Emily Rourke's personnel file in October 2019, with specific modifications to the record of the 2019 separation. Ferris looked at her steadily. She provided corroborating documentation she had retained privately, electronic records of the instruction, timestamp data that establishes the modification sequence. "She kept records," Emily said. "She kept records," Ferris confirmed. "She said she didn't know why she kept them at the time. She said she told herself it was just in case." Emily looked at the floor. "In case someone asked," she said. "Yes." She thought about Marilyn Tross, a woman she had never met, keeping files for 4 years in the private architecture of her own conscience, not acting on them, not coming forward until her daughter joined the service and made the weight of what she was carrying suddenly unlivable. Not heroic, not simple, just human in the most complicated sense of the word. "What happens to her?" Emily asked. "Her cooperation significantly mitigates her exposure. The prosecutors are recommending a non-custodial outcome given the voluntary disclosure and the depth of the corroboration she provided." Ferris paused. "She asked, through her attorney, whether you had any statement she should be aware of before sentencing." Emily sat with that question for a moment. "Tell her to be honest about what she did and why," Emily said finally. "That's all I have." Ferris nodded. The testimony had taken the morning and would extend into the afternoon, working through the full network. Voss at the top, Mast as the operational executor, Tross as the records specialist, and below them a chain of smaller decisions and deliberate blindnesses that had allowed the procurement fraud to run for 5 years and the suppression operation to successfully erase a person's military career. Hale's involvement with the hospital end of the network was a separate but parallel thread that would be addressed through civilian federal proceedings. By the time Emily left Helena in the late afternoon, 17 people had been formally identified as subjects of the federal investigation. Voss remained in federal custody, her rank suspended pending resolution of the charges. The obstruction charge alone carried a potential sentence that would end not just her career but her freedom. The witness tampering charge, given the specific nature of what she had attempted, was unlikely to result in leniency. Emily drove back to Millerton in the gray afternoon light and thought about what it meant to watch a system that had failed you begin, slowly, imperfectly, with the grinding inefficiency of all large institutional processes, to correct itself. She did not feel triumphant. She had expected to, had imagined that moment at various points over 4 years, the specific satisfaction of being proven right in ways that could not be argued with. What she felt instead was more complex and more durable than triumph, something closer to the end of a sustained physical effort. The moment after you've been carrying weight for a long time and you set it down, and your body doesn't immediately feel lighter, it just feels like itself again, returning to its own baseline, learning what it is without the extra load. The formal reinstatement review was completed in 19 days. Not overnight, not without paperwork and interviews and 2 formal hearings at which Emily sat across tables from people in uniforms and answered questions about events that were 4 years old with the precision her training had given her and the patience her subsequent years had built. Not without moments where the process moved so slowly she had to actively resist the urge to push it faster, knowing from experience that pushing made things worse. 19 days. On the morning of the 19th day, she received a formal letter from the Army's Personnel Command, delivered to the address of the apartment on Route 9, with the government seal on the envelope. She opened it at the small table by the window. She read it standing up because she had not thought to sit. Her record had been corrected. Her 2019 separation had been reclassified from involuntary administrative separation to honorable service completion. Her commendations, which had been suppressed along with the personnel file alterations, were restored to record. Her rank at time of separation, Major, was formally reinstated to her service history. At the bottom of the letter, a line about the formal Army commendation that would be presented in a separate ceremony recognizing her service at Cascade Ridge Medical Center during the Ironfield mass casualty event of November 2024, and her role in supporting the federal investigation that followed. She set the letter on the table. She stood in the apartment with the morning light coming through the blinds, and she thought about who she had been when she read the suspension letter in Gerald Forsyth's office 19 days ago, and who she was standing here now, and whether those 2 people were different in any meaningful way. They were not. That was the thing she kept coming back to, the thing that was hardest to articulate and most important to understand. Nothing had been added to her. Nothing had been installed or granted or given that was not already there. The record had been corrected. The truth had been documented. The people responsible had been held to account. But Emily Rourke was the same person she had been at 7 a.m. on November 12th, when a man had handed her a letter and asked for her badge. The systems had failed her. The systems were now, imperfectly and belatedly, correcting themselves. Neither failure nor correction had changed what she actually was. She put the letter in the one folder she kept for documents that mattered and went to work. She went back to Cascade Ridge, not immediately. The hospital spent 2 weeks in a state of administrative reorganization following the federal investigation, with new interim leadership installed by the hospital board and the entirety of the procurement infrastructure being rebuilt from the ground up under federal oversight. She spent those 2 weeks completing her statement for the civilian side of the proceedings, attending the 2 Army hearings, and sleeping more than she had slept in years, which told her something about what the previous 4 years had cost her at a level below conscious attention. When she went back, Marcus met her at the ambulance bay. Not deliberately. He was coming off a shift when she arrived, and they met by coincidence near the door, and he looked at her the way someone looks at a person whose return they had assumed but had not been certain of until they saw it with their own eyes. "You came back," he said. "I work here," she said. He smiled. It was a tired smile, the smile of a man who had spent 3 weeks navigating a hospital in administrative chaos and was now looking at the first genuinely uncomplicated thing of the day. Inside, the ER floor had a different quality than she remembered. Not physically different. Same layout, same equipment, same overhead lights with the same frequency, but inhabited differently. The nursing staff moved with a directness that felt less compressed than before, less like people managing around invisible obstacles. A new interim chief medical officer, a woman named Dr. Sandra Prue, who had been brought in from a hospital system in Seattle, was visible on the floor doing rounds in the way administrators only did when they were actually trying to understand what was happening rather than performing understanding for other people's benefit. Prue introduced herself to Emily with a handshake and a specific directness. "I've read your file," Prue said. "The real one, not what was in the system before the investigation." "Okay," Emily said. "I want to talk to you about the emergency response protocols you implemented during the Ironfield event. We've been using them as a framework for the new mass casualty plan, but I'd like to formalize it with your direct input." "I can do that." "Good." Prue looked at her with the assessing, unromantic attention of a good administrator evaluating an asset. "I also want to talk to you about a more permanent role here, not just clinical. We're rebuilding the nursing leadership structure, and I have a specific position in mind." "Also something I can talk about," Emily said. Prue nodded and went back to her rounds. Callum Briggs found Emily in the medication room an hour into the shift, in the way he consistently seemed to locate her without appearing to look. A quality she suspected would serve him well in his career if it didn't get trained out of him first. "You look better," he said. "I slept." "More than 4 hours?" "Considerably more." He leaned against the doorframe. He had the tentative quality of someone who wanted to say something and was working out whether this was the right moment. "I submitted an application to trauma fellowship," he said, "at UCSF." "Good. I put you as a reference. I should have asked first." "It's fine," she said. "I'll give you an honest one." He looked slightly uncertain at that, which made her wonder what he had expected. An automatic endorsement, the reflexive professional courtesy that passed for recommendation in institutions where honesty was too complicated. She let him wonder for a moment and then relented. "You're going to be an excellent trauma physician," she said, "if you don't let the institution make you smaller than you are. That's what I'll tell them." He absorbed this. It was not uncomplicated praise, but it was real, and she could see him recognizing the difference. He left. She continued her shift. The sentencing hearings for Voss and Hale took place in the same week, different courts, different charges, but with the same public quality. The kind of proceedings that attracted attention because they involved a general officer, a hospital executive, a federal investigation, and a fraud network that had operated for 5 years inside structures that were supposed to prevent exactly that. Emily did not attend the Voss hearing. She had given her testimony in the formal record, and it had been admitted as part of the evidentiary package, and she decided she did not need to be in the room to watch the outcome arrive. She had spent 4 years not being in rooms where decisions about her were made. She had learned to let processes complete without requiring her presence as witness. She read the outcome on her phone during a break between patients. Brigadier General Carla Voss, convicted on all primary charges: obstruction of federal investigation, witness tampering, conspiracy to suppress official reports, abuse of authority. The sentence was 12 years. Her rank was stripped. Her pension was forfeited. The formal language of the judgment included a specific notation about the deliberate targeting of a subordinate's personnel record as part of the obstruction operation. Language that existed in the official record now, permanently, attributing what had been done to Emily's file to a named person with a named motive and a documented instruction. 4 years of her life, named and assigned and accounted for in a federal court record. She read it twice. Then she put her phone back in her pocket and went to see her next patient, Dr. Victor Hale was convicted on 2 counts of conspiracy relating to the procurement fraud and 1 count of obstruction for the record's destruction attempt in November. His medical license was under separate review by the state medical board. He had cooperated partially with the investigation following his arrest, providing information about the procurement structure that corroborated several elements of the case. The cooperation had been considered in sentencing. He received 4 years and was required to surrender his license pending the board review. Emily heard this from Marcus, who had been following the proceedings more closely than she had. He told her while they were both restocking the supply cart in the late afternoon, in the same methodical way he had been doing things on the floor for 3 years. "What do you think?" he asked when he finished. She thought about Hale in the bay doorway the previous November, watching her across the ER floor with the expression of a man who had decided she was a problem. She thought about him at the backup terminal in the nursing supervisor's office, the specific quality of desperation in the way he had been typing. She thought about his voice saying, I was not trying to hurt anyone, the thin, strange quality of someone speaking from a place where self-knowledge and reality had been in conversation for too long without resolution. "I think consequences don't feel the way you expect them to," she said, "when they actually arrive." Marcus considered this. Better or worse? Just different. She lifted a stack of gauze packs onto the shelf. Less clean. He nodded slowly, the way he nodded when he was filling in what she had not said. She met with Stills one more time, 6 weeks after the investigation concluded. He was in Millerton for a separate debrief at the Army field office and called to ask if she had an hour. She met him at a coffee shop 3 blocks from the hospital, a civilian space, not institutional, which felt like a deliberate choice and probably was. He looked less burdened than he had the last time she had seen him in the hospital corridor. Not relieved exactly, but like a man who had moved from carrying something to having put it down and accepted the fact of having put it down. "How is the record correction treating you?" he asked. "Like a correction," she said. "Important, not magic." "No," he agreed, "not magic." They were quiet for a moment. The coffee shop had a handful of other customers. The ordinary late-afternoon population of people with laptops and people on their phones, and one man reading an actual physical newspaper in the window. The mountains were visible from where they sat. "I've been asked," Stills said, "to assist in developing new oversight protocols for the military contracting IG process, specifically the whistleblower intake system." He looked at her. "The intent is to build in structural barriers against exactly what happened in 2019. Mandatory third-party review at the intake stage, independent verification of report processing, that kind of thing." "Good," she said. "I thought you might want to know that your case is specifically being used as the template case for what the new system is designed to prevent." He paused. "Not your name publicly, but internally. Your situation is the example they're building around." She looked at her coffee for a moment. "Will it actually work?" she asked. "Better than what we had," he said. "Whether it works entirely, I don't know. Systems have gaps. People find the gaps." He looked at her. "But it's built with more intention than before." "That's something." "It's something," he agreed. She asked him how long he intended to stay in his current role. He said he didn't know. She told him she had accepted the new position at Cascade Ridge, Director of Emergency Preparedness, a newly created role under the rebuilt hospital structure that put her in both clinical and administrative function, the kind of position that would let her change protocols from inside the institution rather than fighting them from outside it. He said he was glad. She said she was not sure glad was the right word, but it felt like the right next step, and that was enough. They finished their coffee, and she walked back to the hospital, and he drove to his debrief. On the first day she officially occupied the new role, she arrived at Cascade Ridge at 6:50 a.m. and went to the ER floor first, before going to the office with her name on the door, because she had learned over years that the floor was where the truth of any medical institution lived, and she wanted to take the temperature of hers before the administrative part of the day began. The floor was in the orderly, purposeful motion of a morning handoff. Tara, the young nurse who had cried in the break room in November and come back out, was at the central station running the handoff report. She had been promoted to charge nurse under the new structure and wore the authority of it with the particular combination of confidence and residual uncertainty that came from being new to a role you had earned. She acknowledged Emily with a nod that was professional and direct. Emily walked the floor. She passed Bay 11, where Otto Ferris had spent the worst hour of his life, and where Callum Briggs had looked at a monitor and understood something about urgency and the gap between what was documented and what was actually happening. She passed the corridor where she had stood with a phone in her hand and heard a name that had changed the shape of the night. She passed the window that looked out over the parking lot where she had gone to find a man sitting in a car in the dark. She stopped at the window. The morning light was coming in at a low angle, the November sun doing what it did in Montana in the days before the real snow arrived, present but not warm, illuminating without committing. The parking lot was filling with the first arrivals of the day, staff in scrubs, a patient shuttle, a delivery truck backing up to the supply entrance. She thought about what she knew now that she had not known a year ago. Not tactical information, not clinical knowledge, not the specific details of procurement fraud networks and military authorization chains and federal investigative processes. She knew all of those things now in the way you knew things that had been lived rather than studied. But that was not what she was thinking about at the window. She was thinking about the particular quality of being dismissed. Not the abstract concept of it, the word itself, the political and institutional and professional dimensions that were easier to argue in large terms. The felt experience of it, standing in a room where the people around you have decided, before you speak, that what you have to say does not merit serious attention. The way it accumulated. The first time you registered it as something deliberate rather than accidental. The decision you made, consciously or not, about what to do with the accumulation. She had met people over the years who had been dismissed and had internalized it, had come to inhabit the smaller space the dismissal assigned to them, had learned to move carefully, to not be seen, to contain whatever was largest about themselves into something that fit the expectations of the people around them. She understood why. It was in many ways the more rational adaptation, less friction, less cost, less of yourself at risk in any given room. She had never been able to do it, not because she was especially brave or especially principled or any of the clean, generous things that got attributed to people in retrospect when the outcome turned out to be the right one. She had not known in November of any particular year that the outcome would turn out right. She had just been constitutionally incapable of making herself smaller than she was, and she had paid for that over and over, and it had also, eventually, imperfectly, at great cost, been the thing that changed everything. That was not a clean lesson. It was not the kind of thing you could put on a poster or reduce to an inspiring sentence. The cost was real. The 4 years were real. The specific weight of being erased, of having the documented record of what you had done and who you were deliberately altered, was something she would carry in some form for the rest of her life. But she was standing at this window, in this building, with her name on a door down the corridor because she had refused to let the dismissal be the final word. Not out of heroism. Out of something more stubborn and less elegant than heroism. The simple inability to accept that the version of her the institution had decided to see was the true one. There were people in rooms right now, in hospitals, in military installations and offices and courtrooms, who were being told that their version of events was wrong, that their assessment was incorrect, that the problem was their attitude, their approach, their failure to understand how things worked. Some of those people were wrong, some of them were right, and the terrifying essential truth was that the institution around them was not a reliable instrument for determining which was which and never had been. What you did with that truth, whether you let it make you cynical and careful and small, or whether you kept doing the work with the full weight of what you actually knew, was the only real choice on the table. She had made her choice. She kept making it, daily, in the accumulation of small decisions that either honored what she knew or didn't. She turned from the window. Tara had a question at the central station. A new resident was looking for someone to walk him through the Ironfield protocols that had been formalized over the summer. There were 3 patients already in triage, and the morning had not officially started yet. Emily walked toward the station. The floor was moving. She moved with it. There was nothing clean or complete about what had happened. Not the investigation, not the reinstatement, not the sentences, not her own understanding of who had done what and why and what she felt about it. There was nothing she had recovered that did not also carry the shape of what it had cost her to need recovering. But she was here. She had stayed herself through every year that had tried to make her into a smaller or more convenient version of that self. She had refused dismissal not once, dramatically, but continuously, in the long, unglamorous work of simply persisting in being exactly who she was. That was what they could never take from her, not the title, not the office with her name on the door, not even the corrected record, though that mattered more than she had words for. What they could not take was the knowledge that when it counted, when the floor was in chaos and the ambulances were coming and nobody knew what to do, she had been the person who walked back through the door. That had always been true. It would always have been true, regardless of what any document said about it. She picked up the first chart of the day and got to